Hi, and welcome back to the Middling Along podcast. My guest this week is Dr Mridula Pore. She is the CEO and co-founder of Peppy Health. It's a mobile app which aims to transform digital healthcare in the areas of infertility, pregnancy, early days of parenting, and menopause. Welcome along, Mridula.
Thank you, Emma, for having me.
It's a pleasure. So, for full transparency, this is the part where I mention that the company I work for in my day job actually provides access to Peppy Health for its UK employees. And that's how I became aware of the app, firstly. And I've signed up, I've used it to find out more about perimenopause and menopause. And so far, I'm very, very happy, very pleasantly surprised. Very grateful that our company has been providing us with such a great resource. Maybe we could start off and I can ask you to tell us a little bit about your background and how you came to start Peppy Health with your two co-founders.
Absolutely. So professionally, my background has been in healthcare now on the commercial and strategy side for a number of years. I started life as an engineer. So I did my undergrad in chemical engineering here in the UK and then moved to the US to do my PhD and my MBA and focusing on pharmaceutical manufacturing processes. So I did that at MIT for a number of years and was really sort of around a lot of technological innovation, a lot of startups, and that whole infrastructure that was really, very vibrant in Boston and Massachusetts at the time, less present here in the UK, but you could start to see the early glimmers of it. And then when I came back to the UK, after I'd finished that, I worked with McKinsey, the consultancy in their healthcare practice for a number of years, doing a lot of work with the NHS and also with the private sector, but exclusively in healthcare. And really what that showed me is just how big of a gap and therefore an opportunity there is in making healthcare more accessible and affordable. And then I spent some time with Novartis Group running one of their business units in the UK with generic pharmaceuticals. So as drugs go off patent, launching those into the retail and wholesale pharmacy space. So you could, sort of a bit of, so I guess a bit of a jack of all trades in healthcare, really with roles that were focused around the commercial and strategy side. But I could start to see this gap emerging. I mean, I have two young children. I had them both when I had P&L responsibility for a sizable business. So I'm sort of also really conscious of how that experience affected me on both a personal and a professional level, but also seeing how different life events were affecting the people who I was line managing, either as a first line or a second line manager, what knock-on impact that had on themselves, their colleagues, me as a manager in terms of, keeping show on the road, while trying to be a compassionate and trying to adjust for these real big things that are happening in people's lives. So that was sort of where I was at in probably my getting onto my mid-30s, and I just could start to see the London health tech scene coming to life now. There was some investment, there were people around, there were companies around doing some interesting things. I joined another healthcare startup to begin with, met Max and Evan. We were all hired as part of the first management team there, but very quickly we realized there was something there that we all wanted to work on together, or at least we wanted to work together. We didn't really have a clear idea of the concept of Peppy as it exists today. But then we started working on that. It was the end of 2018. And so now coming up to 3 years later, here we are, which has been quite an exciting ride.
And could you tell us a little bit about how the Peppy app works? Like how would a typical user engage with it for the first time, say, and how does it work?
Yeah. So typically people would find out about Peppy as you said, you did, Emma, with through your employer or maybe through their insurance company, because we have some insurance partners and we'll be launching some other partnerships soon. But the way that we work is it's funded by employers in almost all cases, and it's free for the end user. So you might find out about it through, part of your town hall or part of a newsletter or part of if you have employee resource group, thing like that. It could be a poster on a wall in a call center or a leaflet on your desk. We work with employers to really make sure that all their employees are made aware. And the main thing that we want to make sure is people don't feel these are taboo topics. So we don't want there to be any shame or concern about accessing Peppy. So you don't have to tell your line manager, you don't have to tell HR. You simply can, grab the QR code and download the app as you would with any other app. And when you obviously we ask you a few questions to register on it, and a few things happen when you log on. One, we will suggest some of the content that's relevant for you based on what you've told us. So articles, we've got video content, and you'll get a chat channel that opens up with one of our practitioners where you have access to a professional, qualified health professional, to chat about anything that's bothering you, or just to get introduced, saying I'm nothing bothering me right now, or I want to find out more. That's also perfectly fine. You don't have to have a particular problem to come in and use Peppy. You can use it as a way to just sort of get educated, find out about things that then may later then come down the line. You can also sign up for live events. So we'll have sessions on which are either more like a talk or more like a small drop-in group. And if you need to, you can also have access to one-to-one video or phone consultations if you've got something that you'd like to dive in to more depth, say in menopause with one of our menopause nurses, or fertility with one of our fertility nurses, or for the new parents if it's around infant feeding or sleep and so on.
I think that in particular right now, when it's probably harder than it would normally be to get access to your normal GP or kind of healthcare professionals, just having that available at kind of a time that can flex to you and your needs is incredibly helpful. I haven't tried out the one-to-one consultation yet, but I think it's a great idea. And I haven't been to any of the live events yet, but I keep meaning to. I will do.
And our point at the way we've designed Peppy is exactly that. I mean, people are working, and they, these are episodes when you're not necessarily so crucially ill that you're in, cuddled up in bed with all the time in the world to go and do this. You're doing this, you're trying to look after your health alongside, work commitments, family commitments, a social life, hobbies, activities, all these other things that we'd much rather be doing, quite frankly, than looking after our health. So that's exactly the idea. You can send a message, while you're at the bus stop or waiting to pick up your kids, or join a live event, in your pajamas from your couch. People do. That's absolutely fine.
Dip in and out as
much as
you want.
Exactly. But if you need us more, we'll be there. And if you need, if you don't need us right now, that's great. We'll be here, when you're ready.
So presumably, if somebody listening to this was thinking, this sounds great, I'd like to encourage my employer to sort of explore this as an employee benefit. How is there a way that they should go? I mean, presumably they would have to go to the HR person or the HR department, and
I mean, they can either contact us directly on our website, or just email us at hello@peppy.health, or ask if they want to talk to their HR team. We've got various case studies and resources that people can have a look at on there, or take to their HR teams. And obviously once we've got, once they reach out to us, we'll pick that up and would love to have a conversation.
And are you working outside the UK as well, or is that a sort of a next?
It's a next step. We're exploring it, but right now it's only available in the UK.
And are you thinking of expanding this out beyond the sort of those three core areas that we've already talked about?
Absolutely. So we are developing right now and getting ready to launch our men's health service. And this is about really in a similar way, menopause obviously is about specific hormonal changes that occur in somebody who's, obviously biologically female, but men's health also goes through a transformation in midlife, whether that's things around, and it may not just be midlife, but most people this affects them around midlife. So things like urological issues, you're changing sort of needs of your cardiovascular system and bone health, sexual health, mental health. We know that men do tend to suffer disproportionately from mental health issues, and particularly very acute mental health issues, and part of that is not feeling, again, coming back to this issue of taboos, and particularly taboos in the workplace, feeling like they can talk about that with anyone. And so what Peppy Men is designed to do is to give people that sort of confidential space to discuss these concerns that they may not feel comfortable taking to a healthcare professional, their GP, may not even feel comfortable discussing with their best friend or their partner, but giving them a space to have those conversations.
Yeah, well, it's interesting whether that having that kind of anonymity of the sort of the barrier of the phone in the way, being kind of letting people just kind of let go a bit more of that and shame and taboo.
Yeah, some of our research, I mean, that it's actually kind of now reasonably well documented that actually tech enables people to talk about things that they otherwise wouldn't necessarily feel comfortable talking about face to face with a human being. And some of our own research also supports that. So we did some work with the NHS as part of the COVID response, supporting new parents who, of course, were incredibly vulnerable and isolated. If you've got a new baby at home, it's an isolating time anyway. And particularly with COVID, when you couldn't have friends and family visit, your healthcare professionals weren't checking in on you as much as they might otherwise have done. We found that that by using Peppy, some early studies showed that actually some groups who are typically do not seek healthcare support as much as others used Peppy just as much, and so it acted as a bit of an equalizer, and they rated it more highly. So particularly around Black, Asian, and ethnic minority parents who tend to have worse outcomes and tend to seek less healthcare support. So yeah, absolutely. You know, we've got this, the signals are there that around these sort of taboo topics, there are ways in which you can make it easier for people to communicate, get the education, information, reassurance. You know, sometimes it's reassurance, is this normal?
Yeah.
Like
it's another layer, isn't it, on
yeah.
top of the sort of what's already out there. It's I guess it's not necessarily halfway in between, but if it's, you know, if it can help take some of the pressure off the sort of the NHS type services, then that can only be a good thing.
Exactly. And we're trying to do both. We're trying to sort of, for those sort of, you know, lighter touch queries, reassurance, information needs, where, you know, people don't always even bother to go to their GP for that kind of information. We can be a trusted source. But on the flip side of that, if someone actually does need clinical assessment, also nudging them to go and get that.
Well, and knowing that's the next step, that they might not know themselves, but to have an expert say, look, I really think you need to.
And so, you know, like I said, our professionals, they're all qualified health professionals, whether that's nurses or counselors or board certified lactation consultants or, you know, NCT practitioners. So they are qualified to sort of know, okay, there's something here that's worth getting checked out.
You mentioned mental health. So sort of honing in specifically on sort of the area of menopause, does Peppy offer support in terms of sort of mental health as much as the sort of the physical symptoms?
Absolutely. And in all of the sort of episodes and life episodes that we deal with have, you know, they're multifactorial. They're about your physical health, they're about your mental health, your emotional well-being, your relationship well-being, whether that's with an intimate partner or whether, you know, your manager. And so our service is designed to kind of help you in all aspects of that. So as well as your sort of core practitioner, which might be a nurse, say, in menopause, if you need it, you can also open up a chat channel with a counsellor. We'll have live sessions and drop-in sessions that are discussing, you know, mental well-being, how to manage your own mental well-being. And like I said, if at any point our practitioners feel like you could benefit, we can also help you, direct you into whether that's NHS services, or if you happen to work for an employer who offers other private services, you know, kind of give you details of that so you can seek that support if you need to.
And if somebody was, say, finding it hard to address their symptoms or their particular situation with their employer, is there a bit of a conflict of interest there? Would your team be able to sort of help them come up with some strategies?
Yeah, I mean, we see it as, we don't see there being a conflict of interest. Obviously, we don't intervene in that discussion between, you know, an employee and their line manager, and we absolutely do not disclose any personally identifiable information. So, you know, Peppy is a confidential service for the user, so there is no feedback, you know, that Gwen from accounts said that does not happen. Even we actually don't even pass on. Sometimes employers have asked us, said, well, we heard there was X, Y, and Z. Or like, we can't tell you that. We've got to, you know, we obviously have an obligation.
So it's a similar sort of level of patient confidentiality,
yes,
as you would have with a GP.
Absolutely. So what we do report back to the employers is obviously uptake, usage in aggregate. Sometimes, you know, we can share with them particular insights around, you know, obviously with a lot of things changing, themes that are coming up for their population that they may want to look at addressing. That's as far as we go. The sort of privacy angle is something we take extremely seriously. And at no point anything you say to any of your Peppy practitioner, unless obviously there's a sort of safeguarding or, you know, safety
Sure.
concern. In any case, that won't go to your employer. That will go through other avenues, but that doesn't go outside the Peppy environment.
So I'm interested from the point of view of your experience of sort of startup land.
Mm.
This wasn't obviously your only kind of foray into that world, but as a woman and as the CEO of a company, are there any kind of good, bad experiences that you would be sort of happy to share, or anything that kind of really surprised you about it?
So I think the timing for me professionally was important. I mean, I think for me, when I chose to move into the world of startups, I'd sort of banked enough experience and credibility and professional network through my previous roles that I felt like that was a risk I could take now, at this stage in my life. Like, if I could try it, what's the worst that happens? It doesn't work. I mean, it's quite financially quite costly, but actually was in a stage in my career where I could then go back into the corporate world or the professional services or whatever it was, with the experience that I had. And also with my children. I mean, they were very young while we've been building Peppy. They're now both at school, but actually I had heard from various people that teenagers are actually they only get harder as they get bigger.
So I hear, yeah,
As
slightly
they
dreading
get
that.
bigger, and actually that's when you really, really do want to be around quite a lot. So I figured I've got a bit of time till we get to that stage. But also, having a startup gives you flexibility as well, right? So we work really hard, and sometimes you've just got to drop everything. And Peppy takes over 24/7. That's just how it needs to be. But then equally, I am also have some flexibility around my schedule. Obviously, as the team gets bigger and bigger, and has put in some of the internal processes in place, that obviously puts in some limitations. But you do still have a lot of flexibility around when things need to get done and how you do them. And that was definitely very helpful in the early stages of Peppy. I think in terms of the CEO role, so I actually share the CEO role with my co-founder, Max.
Mm-hmm.
So he works mostly with our employer partners, and I tend to lead on some of our internal infrastructure building and also on our investment and finances and so on, and working with the tech community. But there are three of us as founders, and that's just huge compared to being a solo female founder, both because we have very diverse professional experiences, very diverse personal experiences, and that's just such an incredibly rich space to be in when you're trying to solve for a problem. One of the three of us will have encountered something similar that we can reference in our careers, and if we don't, we have a network of people around us. So our investors, our advisors, we have, who are all there on our, gunning for us there to support us. So that makes a huge, huge difference. I mean, I think given what we do, I mean, it's not for me, certainly being with co-founders means it hasn't had that sort of lonely at the top feeling at all. And that's made it definitely the journey a lot more enjoyable. And in terms of being a woman, I mean, for what we do, it's just amazing. I mean, first of all, I'm deeply passionate about what we do, because not only just for the health aspects of Peppy, but I also fundamentally believe that these life episodes impact women's self-confidence, their ability to seize professional opportunity, and then the knock-on effect of that is their financial well-being as well, and their ability to make choices about their life, which is so important. But also, Peppy is fundamentally about being authentic as well, right? Being able to say, actually, this is happening. It is affecting me. It's affecting other people. It's for employers to acknowledge, yes, these are real things that are really big things in people's lives. And we know that sometimes they will knock you off center, but that doesn't mean that you're not in any way that you're not a valued employee. And we should be in this for the long haul. And so actually it's been really fun and very liberating as doing Peppy and being able to talk about some of the things in a context which previously I would never have discussed in a workplace.
Well, so that was going to be the question, I suppose, is whether people were really taking this seriously as a sort of an area for a kind of a health tech company, or whether that was a sort of something that has only really, because obviously menopause now is a lot more kind of in the public consciousness, if you like. There are sort of, TV programs and news articles and books coming out more and more and more. So was that something that was quite hard to get investors to kind of to gel with?
I think we've seen definitely the tide is turning since we began this journey. And I think people could, when we started Peppy, people could kind of, well, we started with baby, which obviously the topic of supporting new parents in the workplace, parental leave, etc., has been around for a while. When we started talking menopause, people sort of like, conceptually, I get it. Is it going to happen? Whereas now it is really happening in a big way. And we see it, in our clients and in the level of interest there is in the market for employers across the spectrum of location, workforce age, spread, gender split, are interested in providing this support to their employees. And, we firmly believe that within a few years, this is going to be the norm for employers who aim to be best in class and want to attract good talent. Because, what does it say about you as an employer if this is something that, these are conversations that people are allowed to have in the workplace and, people that genuinely benefit from.
Do you, as part of what you do you also provide sort of resources for managers in those companies?
Yeah, so we definitely do have some resources that we provide for managers, either through ourselves or through various partners who we work with. But yes, I mean, this is, like I said, a key part of what launching Peppy does is enable permission for people to talk about it. And, managers need to be equipped for those conversations, and particularly senior leaders need to be equipped to talk about this.
Well, I do hope it ends up that just we normalize these things and they kind of step out from the shadows, and people do feel like, it's a perfectly normal process to sort of talk to their manager about this. Not that would do you out of business, but I don't think that'll happen. But certainly the benefit of having those conversations and feeling comfortable talking about that in a work environment can only be a good thing.
Yeah. And the reality is, look, I mean, the workforce is changing so much. So, let's take menopause. Women over 50 are the fastest growing demographic in the UK workforce. That's not something unique to the UK. Globally, we've got everybody living longer and working longer.
And we can't afford that brain drain of talented senior women dropping out of the workforce.
Absolutely. And, the thing is that whereas previously, yes, people had, maybe had children during their working life. Now we can expect to go through like several of these types of life episodes while we've still got a significant portion of working life ahead of us. Both as individuals and as society, we can't afford to have people drop off.
So what are your kind of hopes for the next 3 years for Peppy Health?
Well, it's a super exciting time right now. I have to say, I mean, just with the pandemic and the shift in perspective on employee well-being and the responsibility of employers, it's just exploding. So, over the next 3 years, we, have very ambitious goals to grow as a business and obviously reach lots of people through employers. But we also want to develop our services to make sure that they are as universal as they can be in terms of being relevant for people sort of across the different spectrum of whether that's socioeconomic groups, whether that's, helping to address, some of the racial inequalities that exist in healthcare as well, and to, take Peppy to beyond the UK.
I shall look forward to seeing how that all pans out, and exciting times. Thank you so much for coming along to talk to me today. It's been an absolute pleasure.
Thank you, Emma. Thanks. It's been great.
You've been listening to the Middling Along podcast. Do remember to subscribe to be notified when our next episode is live. And why not visit the blog at www.middlingalong.com to sign up to my newsletter as well. I do hope you enjoyed listening today. If you did, I'd be really grateful if you would consider leaving a short review, as that helps people find the podcast and helps get it noticed. Hope you can join us next time. Goodbye for now.